We noticed some significant changes in Tony's personality about 2016. He was not as social as he used to be. He was kind of apathetic. He didn't engage in the family as much. He didn't seem as concerned about things he maybe should have been concerned about. So we got the diagnosis in January of 2017. Tone was textbook FTD, frontal temporal dementia. And from then on, we started our care with Mercy Memory Clinic and have had nothing but absolute wonderful experiences with them. They're just absolutely amazing and have really helped guide us on this journey because there's so much to dementia. There's so many moving parts and for a family, and they have really helped us through that.
As our population ages, more older adults are living with complex chronic conditions, including dementia, which claims the life of 1 in 3 older adults and is the 5th leading cause of death in our state. Today's options for senior living are inadequate, and we cannot be blind to the increasing needs of older adults in the coming years. That's why Mercy has partnered with Presbyterian Homes and Services, a Minnesota-based nonprofit specializing in senior living, to develop HallMar Village, the first inclusive senior living community in Iowa. In an inclusive senior living community, everyone works together to meet basic needs, so all residents feel valued and can live with dignity, engage actively, and contribute to their community. HallMar Village will replace the current HallMar. It will offer 3 housing options: independent, residential, and nursing, and will allow residents, those living with and without dementia, to age in place, to retain their autonomy, to feel secure in their surroundings. All will find meaning and purpose in a community that feels like home.
I need to know that Tony is somewhere where he can do what he wants to do, where he can live his best life. I want Tony's next journey to be where the kids feel they can walk in. It's home. It's his home. You can walk in whenever you want. You can feel the love by the staff, I don't want it to look sterile. I want it to feel home, and I know that that's what Mercy will do. They will make it home.
HallMar Village will also include the Chris and Susie DeWolf Family Innovation Center for Aging and Dementia. This center will discover, evaluate, and implement best practices in aging and dementia, and will be home to Mercy's Memory Clinic, a geriatric medical clinic, an adult day center, the Research and Training Institute, and a second location of the Family Caregiver Center. HallMar Village and the Innovation Center will be the hub of research, training, and education that will offer residents in the community an entirely unique experience.
When the Sisters of Mercy founded Mercy Medical Center in 1900, it was to meet the need for more health care in this area. Now, 120 years later, one of the greatest unmet needs in this community is our understanding of aging and dementia. The Sisters of Mercy are pleased to see our legacy of meeting unmet needs continued through the Innovation Center for Aging and Dementia. Our prayer is that all who use the Innovation Center will lead full and meaningful lives.
For someone in the caregiver role and living this life, it's such a relief and blessing to know that people are trying to build a facility that will meet every need we could possibly have.
HallMar Village is a $74.6 million investment with costs shared between Mercy and Presbyterian Homes. The Live with Purpose campaign will raise $8.5 million. A generous $2 million lead gift from the Chris and Susie DeWolf family for the Innovation Center for Aging and Dementia has already been received.
No startup or medical breakthrough happens without the support of generous benefactors, people who are convinced that a specific initiative and the team behind it will change the world in truly transformational ways.
We strongly believe that HallMar Village is such an initiative, and we sincerely hope that you will join us in making it a reality. we would like to share with you what sets this project apart. The Innovation Center for Aging and Dementia will disrupt the status quo, using research to inform best practices and lead to a higher quality of life for residents, non-residents utilizing these services, and caregivers.
HallMar Village will be a community that feels like home and will reflect the way people lived prior to diagnosis. It will also provide accessible on-site medical care with the Mercy touch you've come to expect.
But most importantly, HallMar Village will give those who are older and those living with chronic conditions such as dementia and their families an opportunity to live with purpose.
We invite you to join us on this journey and invest with us as we innovate and set the new standard of care for our loved ones.